Hey guys, Vicente Andrade here, and I'm an exercise specialist. And today I want to emphasize on the hip flexors, how important they are, and why we should not sit for a long period of time. So very quickly, the hip flexors, they draw your leg to your torso. They help in motion, moving from side to side, going backwards. They also help us stabilizers to stabilize your hip and your lower body. Also keeping the joints of the pelvis and the lumbar spine strong. So we want to make sure we want those flexors strong. One of the things that can cause or be caused by sitting too much would be a gait, hip flexor gait, and that would be a hip flexor weakness. And I'll show you in just a minute at what it looks like. So one of the big things that we would see on patients or clients with weak hip flexors would be the hip flexor gait. And while walking, the patient's trunk leans backwards, and it's also leaning towards the unaffected side as they go from the push-up to the mid-swing. With this movement, the hip remains locked, forcing the trunk to extend. So it would be walking kind of like really tight, really locked, extending that trunk. And the stride of the affected side becomes shorter. And there's also a hip hike during the swing phase of the ipsilateral side, so that the affected side has enough room to clear to clear the floor when walking, so it would look like that. And there's also a circular motion. So a person with really tight hip flexors would walk like that. So we would call that the hip flexor gait. So due to these weaknesses, we could find abnormally tight hamstrings and hip flexors, which don't allow for the full range of motion required. Another one would be tendonitis of the hip flexors due to really tight hip flexors. Another one would be the runner's knee, which is the patellar femoral pain syndrome, and this is to the lack of strength of the quadriceps and its inability to track your knee properly. There's so many things that can cause or be caused by having weak or tight hip flexors, so we want to make sure we avoid that. So finally, in order to avoid that pain or feeling weak or that tightness, we want to make sure that we take care of ourselves. So I would advise you guys to check your posture when you're sitting down, correct that, make sure you're sitting properly, and you know, anything that can help you. Another one would be stretching, moving around, but specifically for the example that I was talking about, I would use a single point cane. And that it's going to help you with your posture. It's going to help with keeping an upright position as well. And hip flexor strengthening exercises, there's many of them. We can do lunges, we can do bridges, we can do supine hip flexors, isometrics, all kinds of things that can help.